we start talking about circulatory infections, and before we get to infections themselves, we have to just kind of recall the anatomy of the circulatory system. I'm not going to bore you with the chambers of the heart and blood vessel and so on and so forth. Things that I want you to appreciate is that, first of all, circulatory system is the blood vessels, okay, blood vessels and the heart, okay, and the most important thing is that blood vessels are everywhere, okay. Infection is systemic. It's really hard for microorganisms to get in the circulation. Think about this. They have to go through the mucous or cutaneous membranes, skin or gastrointestinal or respiratory mucosa. But once they're there, they are everywhere. So if microbes enter the circulation, it is called emia. Viremia, bacteremia, fungemia. If bacteria start to grow in the blood, this is called septicemia. It is specifically used for bacteria. When we talk about septicemia, we generally refer to bacterial growth. And consequences of sepsis can be pretty bad, mostly because of the disproportionate immune response, so-called septic shock. Okay, so septic shock means that the amount of inflammatory proteins, inflammatory cytokines that are produced as the result of bacterial replication in the blood so big that it causes the vasodilation, okay, and hemorrhage, coagulation, DIC, disseminated intravascular coagulation, a lot of bad things going on. Okay. Lymphatic system is another component of the circulation, and as you remember,